So today we're going to be talking about the sympathetic nervous system. So this is kind of known as your fight or flight system. So this system kind of kicks in when your body is stressed, scared, or like exercising, it's excited. It affects your whole body, so it affects your heart, your digestive, your urinary, blood vessels, sweat glands, lungs. Um, so like I said, when the sympathetic system kicks in, your heart rate increases, your blood pressure increases, your breathing rate, your sweat glands increase. Blood is directed to your muscles, your digestive and urinary activities kind of just stop. And then your stored energy is released. Just in case it seems like I keep looking down, I'm relying on my notes over here to kind of make sure my information's right. But yeah, so again, this is, aside from that, this is your survival mode. It prepares you to fight, to run, panic, do things when you're like in that heightened state. So this is a 2-neuron pathway. So every autonomic pathway uses 2 neurons. You have a preganglionic and a postganglionic. So your preganglionic starts in the central nervous system. Within the sympathetic, it uses the lateral gray horn, and it's really called the thoracic lumbar region because it's from T1 to L2. And then you have your postganglionic, and those start from the ganglion. But yeah, and those tend to go to like the target organ where the preganglionic go to the ganglion. And so the preganglionic releases acetylcholine in terms of sympathetic. It releases acetylcholine also for the parasympathetic. And then the postganglionic neuron releases norepinephrine. Sorry about that noise. That's my kitty just opening doors. Yeah. And so the ganglions kind of use a white and the gray ramus. So this is literally just how the signal enters and exits the sympathetic chain. So you have your white ramus, which uses preganglionic fibers. Your white ramus uses preganglionic fibers. So it uses that thoracic lumbar T1 to L2. Your gray ramus uses postganglionic fibers, which are unmyelinated. They're slower. They go to the body, right? So then there are 3 possible paths that the signals can take. So the sympathetic, so it's called the sympathetic chain ganglia, the collateral ganglia, and the adrenal medulla pathway. So just starting off with briefly a sympathetic chain ganglia, it's located along the side of the spinal cord on the posterior. It's just a chain going down the side. You have 2 sets. And so to me, how I think about it is they control the head, the outer region. You have your body wall, your skin, your sweat glands, blood vessels, head, thorax, all of that is in control. And then you have your collateral ganglia. And the collateral is located anterior of the spine. It's kind of near the abdominal, so kind of here. Aorta, my heart's right here. Aorta goes down, so it's like located down there. And then, so the preganglionic fibers form the splenic nerves, and they synapse here. So the preganglionic fibers that go to the collateral ganglia, they form the splenic nerves, and they just synapse there. And then the ganglion within here control the abdomen and the pelvis. So within the collateral ganglia, you have 3 different ganglions. You have the celiac, which control, it's like stomach, liver, spleen, pancreas. It's like this upper region, right? And then you have your superior mesenteric, which is like small intestines and the upper 1/3 of the intestines. So right here, my spleen is going to be, I think, down here, right? And my large, you can't really see, but yeah, down here. But the inferior mesenteric is the last 1/3. So it's the bottom part of the intestines. Reproductive organs, so kind of just lower. And so the functions of this is to stop digestion, redirects blood to muscles, releases stored energy. So this ganglia really just stops all those movements from there occurring, and they just force the blood, everything to go. So it's a very central part of your body. To me, aside from the brain, that's the most important, this area. So it kind of just halts the activity there. So it can control this new change that is going to take place. The change is taking place. And then you have the adrenal medulla pathway. So this one is different. It's not going to be like the other two. The adrenal medulla pathway sits above, or the adrenal glands sit right above your kidneys. They're both of them right above. You have two sets. The preganglionic fiber here goes right to the adrenal glands. You don't really synapse like that, right? It's more they go to it. And so you have, I'm probably going to butcher the pronunciation. You have chromaffin cells, and they act like postganglionic neurons. They release epinephrine and norepinephrine. However, they mostly release epinephrine. Probably by like 80% of it is epinephrine, and the rest is like norepinephrine. And they release these hormones. Remember, glands produce hormones. You release these hormones into the blood, and it produces a full-on fight or flight. And it takes long. It takes long to like not feel the consequences of the hormones or the effects of it. Sorry. So your body does use enzymes to break these down. It has to use quite a number of enzymes to break these down, because they're not really just hanging out on the body like that. So that's why, for instance, if you get anxiety, I get really bad anxiety. You feel that for quite some time. It takes a while for your body to be like, all right, we're good. And so then you have your neurotransmitters that are released when these synapses occur. So within the different, at different points in the pathway, different neurotransmitters are used. So in the preganglionic to the ganglion, again, like we said, use acetylcholine. And they're always the receptor name for, how do I say it? So these preganglionic to ganglion, they release acetylcholine. And the receptors, the binders, are known as, can be identified as cholinergic. I can't pronounce it. And then, so for postganglionics that go to the organ, the neurotransmitter, in terms of sympathetic, tends to be norepinephrine. And these are adrenergic type of receptor. So except with the exception that sweat gland, skeletal muscles, they use acetylcholine in the postganglion. This is the only exception. Like I just said, sweat glands and skeletal muscles, they use acetylcholine and instead of norepinephrine in the postganglionic neurons within the sympathetic system. It's kind of tricky. But norepinephrine really it stays active in the body until the viscosities reabsorb it. Viscosities are kind of like pearls, like chains. They kind of just hold a bunch of neurons, bodies. They're just like a swollen neurotransmitter release site. That just like by having large areas, they can spread norepinephrine all over the body. And so these are broken down by MAO or COMT enzymes. And then we're almost done. So sympathetic receptors. These determine the effect on the target issue. So you have alpha receptors. You have your alpha 1 and your alpha 2. So your alpha 1, it constricts smooth muscles. And by constricting, imagine your blood vessel, it's getting tighter, your blood pressure goes up. By alpha 2, it inhibits norepinephrine. So by inhibiting norepinephrine release, you get almost like a negative feedback control. This is kind of like, to me, I guess a better way to word this, the alpha 2 would be that it's kind of what tells your body, okay, we're making a switch to parasympathetic or sympathetic. It's kind of what tells your body we're making a switch. Something's happening. We are either going parasympathetic or sympathetic, vice versa. And then you have your beta receptors. So you have your beta 1, which is the heart. It increases heart rate and the force of the pumping of blood pressure, or it just increases. It increases heart rate, right? And then beta 2 is the lungs and the blood vessels. So this increases blood flow. And beta 3 kind of breaks it causes a lipolysis with adipose tissue. So it breaks down the fat for energy. So a quick trick is for beta 1, you have one heart, aka beta 1. You have two lungs, beta 2, and then you burn fat. And so a couple last quickly to touch on is norepinephrine versus epinephrine. So again, norepinephrine is released by postganglionic neurons. It has a very local impact because it's kind of going more towards the site, right? It has a short duration, and receptors are mostly going to be alpha 1 receptors. They mostly constrict, increase blood pressure. And then, so we didn't mention the epinephrine. I think we did. Yeah, we did. The epinephrine, norepinephrine is released by the adrenal medulla, and the effect of the adrenal medulla causes affecting the whole body. So by the duration of it is going to be longer, and the adrenal medulla actually uses alpha and beta. So the adrenaline causes a full out body, effect. And then so the sympathetic causes kind of two levels of activation. You have your reflexes, which are small targeted changes, and you have full activation, which is like when you're scared, when you're in pain, you're in your stress, your whole body floods with norepinephrine, epinephrine, all these chains, and the adrenal, and so it kind of causes this whole activation. Yeah, I mean that's basically it for the sympathetic.